President Joe Biden signed an executive order last week reversing the ban on transgendered people serving in the military. The order, quote, immediately prohibits involuntary separations, discharges, and denials of reenlistment or continuation of service on the basis of gender identity. With me now is local surgeon Dr. Sherman Leis. Dr. Leis runs the Philadelphia Center for Transgender Surgery and is considered a pioneer in transgender issues. One of his goals now is to help bust some of the myths surrounding the transgendered community. Doctor, thanks so much for being here.
Pleasure to be here.
So let's stick with politics for just a second. When former President Trump announced the military ban, he said it was because of, quote, tremendous medical costs and disruptions transgender people in the military would lead to. And many of his supporters felt that was reasonable. How do you and did you respond to that?
Well, it's not reasonable at all. There are about 15,000 transgender people in the military, and there's no evidence that there's any disruption or other problems related to their presence in the military. Biden did a tremendous thing by opening this up and reversing a lot of those really negative decisions that Trump made about the entire LGBT community. He really accented, and he will continue to accent, the quality of people, their qualifications, their training, their ability, their education, rather than focusing on gender identity or race or sexual choices or religion or ethnicity. That's how it should be in the world. And that's what Biden's going to do. He's going to be much more fair. In addition, Biden also said that medical care for transgender people will be included. And Trump tried to eliminate medical care. We have had many patients come for treatment, and they didn't get any support at all from the medical insurance that military or veterans are given.
At the beginning, I mentioned you're wanting to sort of bust the myths that are out there about the transgender community. What are some of the myths that you are always trying to sort of right for people?
Well, there are a lot of them. One thing is that transgender people are mentally ill. They're not mentally ill. The American Medical Association and the American Psychiatric Association have recognized gender dysphoria as a medical condition, not a disorder or an illness. And they should be treated the same as anyone. Of course, if they have issues and because they've been mistreated because they are trans or gay or lesbian, then that's enough reason to give any normal person some anxiety or depression. And many people need treatment for anxiety or depression, whether they're trans or not trans. Some people, there's another myth that transgender people are dangerous. There's no evidence at all that transgender people are dangerous. There's danger to them because of discriminatory people that want to beat up on them, both mentally and physically. So there's no evidence at all that that transgender kids in school are dangerous or threatening to anybody else. They're the ones that get threatened. They're not threatening at all. There's a big myth about the difference between gender identity and sexual orientation. A lot of people, and I would say most people, don't understand the difference between sexuality and gender identity. Gender identity is how you want to present yourself and to the world. You know, sexual orientation is another issue that's related to trans people or non-trans people. So they're two completely different issues.
Right,
you know, sexual identity is who you're attracted to, and gender identity is how you want to present yourself to the world.
You have said that the attitudes, though, about transgender people have changed a great deal in the time that you've been working with that community. What are the biggest changes you've seen?
Well, first of all, as people get educated and become less discriminatory, and also since that's made a terrific improvement in the general population's attitude towards LGBT people. We see it more in the gay population that have been more accepted as time goes on. Some people will never change their mind. Some people are just rigid and don't want to listen to educated people.
So an issue being discussed right now is whether or not transgendered athletes should be able to compete in sports and the Olympics. You believe that they should. Tell me about that.
I think they should, because when a transgender person is on hormones, for take example, a male patient, a male person who transitions to female, they may or may not have surgery. But if they're on hormones, for instance, and especially for those that have had surgery, and those that are on hormones, their bodies change, their muscles atrophy, shrink up, and so they become more feminine bodied than they were as a male with male hormones. The testosterone levels go down to almost nothing, usually much lower than a normal male. And so to me, it's fair for them to compete.
Let's talk about Dr. Rachel Levine, the now former head of the Pennsylvania Department of Health, tapped by the Biden administration. She's had a lot of negative things said about her, even by high-ranking politicians in Pennsylvania. She's remained fairly quiet about all of it. Did that surprise you at all as you saw, I guess, her career unfold and the attention that she garnered?
I think that shows a real lack of morality and character for anyone in public life to go on the news and put someone down who he knows nothing about and whose situation he doesn't understand. Levine properly rose above that. Like Michelle Obama used to say, when they go low, we go high. And that's what she did. She presented herself in a professional way and said that people should be more sensitive about these issues and try to understand issues, not just criticize and put people down and denigrate people because they're different than they are. They should recognize training and ability and quality and not let race and religion and gender interfere with their clear thinking about issues. Let them focus on the issues. Rachel Levine happens to be a very highly trained physician. She's a graduate of Harvard, for God's sake. She went to Tulane Medical School. She's a board-trained and certified pediatrician and psychiatrist. She's a very high-quality individual, has always handled herself in an elegant and very professional way. That's what we should look at.
Dr. Sherman Leis of the Philadelphia Center for Transgender Surgery, thanks so much.
My pleasure.